back in school, I used to take the tests a little bit, overthink questions. And when I was in dental school, and then when I discovered this strategy of like, okay, I'm gonna, dedicate 40 minutes, 50 questions in 40 minutes, circle the questions I don't like, moving. Yes.
Yeah, you should talk more about this. This is good, like advice to give.
Yeah. So like what I found to be useful is I try to get through 50 questions in 40 minutes. Whether I answer the question or not, that's fine. Like I don't have to answer every question, but I go through them. So when I'm at question 50, I want to look at the clock and I want to see that 40 minutes have passed. So I kind of check how I'm doing. Like if I'm at question 25 and it's 15 minutes, that means I'm ahead.
You're good, yeah.
So I could think a little bit more if I want to. But if I'm at question 25 and it's 30 minutes, then I'm behind. So I need to speed up, which means I have to leave behind more questions. I'll circle and move on and not answer the question if I don't like that question. If I find it to be for sure. Yeah, if I look at a question and it's like, this question is irritating. It's too annoying. It looks, I need to think about it. I'm going to circle it and move on. As long as I get to 50, somehow when I get to the end of the test, there's always a lot of time left when I do the strategy. And the questions I left behind always end up being a lot less than I thought. Like I thought maybe I left so many questions, but I go back and it's like, oh, maybe like
this wasn't. Why did I leave this one behind?
Some are like that, and some are like I just realized that it's a lot less questions or fewer questions than I actually thought I left. Right? Maybe it was ended up being, 10 to 20%, or, but yeah, that's what helped me, and I used it in multiple exams and always been working. So that's what we teach here. I don't know. Do you use that technique in the exam? It worked for you?
Yes.
No, it doesn't work for everybody.
No, it did. I think it does work for everybody if they're actually using it. Because look, it only makes sense if some question is making you nervous or like, oh, I need to think more about this. If you need to think more about a question, it will make you nervous because you might not find your answer right away. You're going to waste a little bit more time. Yeah. Then you're going to feel like you're late. Everything like snowballs into you getting nervous, and that will impact how you answer the subsequent question. Yeah, because if you're nervous now and you're like, you might get to a question that's considered easy and answer it incorrectly. Yes. Or might not even get to that easy question. Yeah, exactly. Like if you waste your time on one question, you get to the end, you have to like rush through, let's say 10 questions. What if like all those 10 were easy questions, or 8 of those were easy questions? You wasted your time thinking about one difficult question, and then you just have to rush through easy questions. Yeah. It works for everyone. It works for everyone. They're not using it right. Yeah, they are just not using it right. Or they're not using it. They say they did, but they didn't. Or maybe they're like mentally, they can't get to themselves to that point. Some people just can't do it. To skip a question. Yeah, exactly. Some people just go like, I can't leave this one behind. I keep thinking about it while I'm here. Yes. I give people the example during the midterm live. Remember, I'm like, well, if you're treating a patient right now, you can't be thinking about the other patient. The previous patient, what do I do with that patient? You got to be able to mentally, focus on what you're doing at the moment. Yeah. It's a good mental, skill to have, right? Like you have to be able to block out. It's essential. Essential. It's essential for a doctor, for a dentist. You got to be able to. For test takers. For test takers. Yeah, that is truly.